Hello there, Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. The most exciting name in podcast ever to come about. Not. However, today I would like to discuss with you before this Labor Day weekend pain, specifically neck pain, and how it affects your ability to sleep, and basically why it affects your ability to sleep. So you can have neck pain, pop a few Advil, pain goes away, but you're not sleeping the same. Well, for one thing, you're not addressing the what's causing the pain in the first place. But there's a big bunch of neuronal circuits that really talk to us in terms of how and why you're not able to sleep. Okay? And the reason why is in the base of your brain is called the brain stem. The brain stem's kind of below. That's what's called the brain stem. It's like where you would hold flowers. If you give us think of the flowers as the brain. Brain stem is where you hold the flowers that you give to your loved one, or if you're in trouble, your wife. Anyhow, so what it does, it controls many different functions. And there's a simple explanation. It's a very simple definition, probably a better way to remember the idea because it's called the reticular activating system, RAS for short. Once again, the reticular activating system. And what it does is it kind of filters out some of the information that doesn't have to go up into the rest of your brain. Okay, there's a lot of input. You can get, you know, you can process like 40 things going into the brain, but it doesn't need all of it. And it's used as a filter to prevent things from going higher up. The stuff that's important does get through. So think of the reticular activating system as a bundle of nerves in your brainstem that filters out unnecessary information so the important stuff gets through. And it's the reason you learn a new word and then start hearing it everywhere. Think of it this way. You're interested in a red BMW. Nobody in your block has one. You're the first guy to get it. And all of a sudden, all you see are red BMWs. Now, they were there before, you were just not aware of it. So the information is getting prioritized and getting set up at higher levels in your brain. And that's one of the functions of the reticular activating system. But as it relates to pain, let's go through some of the other stuff. Okay, that's a big one is to understanding it on a simplified level. But the reticular activating system is responsible for many things. But let's go over wakefulness. It helps regulate your sleep and wake cycle. So if you've got a bone impinging onto the brainstem, that's going to limit the ability for the ascending or afferent nerve impulses to get up to the brain to signal it's time to shut things down and go to sleep. So the neck is just pain's just one aspect of that. But here it is, and here's how it very simply can affect your ability to get good and restful sleep when you can heal. Now, again, Advil leaf, pop them all you want. You're going to take care of a lot of that pain. A lot of the pain that you have in your neck can go be mitigated with over-the-counter medications, opioids. Some people do use opioids. There's people smoking pot for neck pain and headaches for years. However, if you physically remove the interference, you have a much better shot at taking pressure off the brainstem where this particular nerve bundle is. And that's what the reticular activating system is. It's a nerve bundle. It also is about our ability to focus. If you notice, like a kid, one of your kids may be so into sports, they know every single statistic on the favorite baseball team, basketball team, football team, whatever. And yet, when they go to school, they can't focus. It's because they're not activating the reticular activating system in a way to make that a priority. So wakefulness, sleep, awake cycle, ability to focus, and also the fight or flight mechanism. Okay, the fight or flight mechanism is one we call the sympathetic nervous system. And what it does is sympathetic nervous system is located at the very lower part of your spine and the very upper part of your spine. And we have the autonomic nervous system is made up of sympathetic and parasympathetic. Sympathetic is again the fight or flight mechanism. So now we have Our body's due to the amount of stress we're in. Okay, so if you have cervical vertebra, neck, spinal neck bones out of place, it's going to put pressure onto the brainstem. But also, we have to figure in stress is around us no matter what we do, where we go, it's all over the place. And so that is going to make the reticular activating system fire much more. So if a chainsaw going off in your neighbor's backyard annoys you a little bit, and it does, the guy's out there every day cutting wood with a chainsaw, it starts to annoy you more and more because you're becoming more and more aware of it. And so it increases the level of stress. So this is where the reticular activating system really needs to be balanced, but also not have the physical blockage of the cervical bones being out of place. Now, as chiropractors, we call that the subluxation, and subluxation is what we basically fix as chiropractors. It's our bread and butter, but it has implications to much higher level brain function. Okay, much higher level brain function, and if we locked in sympathetic overload, the amount of stress we're under is enhanced by multiples because when you have stress, your body produces adrenaline, norepinephrine, all these hormones that stimulate and help us respond to the stresses in the world, especially how we perceive these stresses. So again, may not be a big stress with the guy doing the chainsaw real in reality, but if he does it every day, you're trying to take a nap, or maybe your kid's trying to take a nap, it becomes more and more how you're perceiving the world, and it just ramps up this fight or flight mechanism. The sympathetic nervous system is overloaded. Now we really want to spend most of our days in parasympathetic, and those parasympathetic, I just try to make it simple to understand, are basically the part of the nervous system you don't think about. You don't think about tears, blinking your eyes. You don't think about digesting your food, urinating, defecating. These are natural body functions. Your heart beating, that is pretty much run by parasympathetic nerves, and those basically go below a little below the neck and above the low back. All of those nerves, they basically go to all your different organs. So I guess it's a leap to say that you know chiropractors are brain docs. We're not brain docs, but what happens here is you have pressure on the nerves, on these spinal nerves in the brainstem, where you have bones out of place. You need to get those bones back where they belong. Okay, the brain does not need to have a bone digging into it, preventing these nerves, the nerve flow from going up or ascending up into your brain. And that's the role of a chiropractor. The chiropractor is going to come in, take the tension out, and thereby release some of your stress as well. Because here, the bone being out of place is a physical stress. And now you're into sympathetic overload because the reticular activating system is not able to fire properly and deal with how you perceive the world. Okay, if you perceive the world because you've got neck pain, or your neck is tilted to one side for a couple of weeks, couple of months, even a couple of years, it's going to hinge how you see the world. First of all, the brain wants to see information, so what they call the writing reflex, where you would actually see things on the horizon. So your spinal bones will actually shift so that your brain can get the information in the proper format, which is another topic for another day. So what I hope you understand now is if you have neck pain, you can have increased stress, but you also can have problems sleeping, and you can have sympathetic overload. So in order to combat that, just go see your chiropractor. And what happens these days is, I mean, medical doctors are not trained. I'm not trained in medicine. I'm not going to tell you what to do for heartburn, or I may even tell you a natural remedy, but we don't pump medications. It's not our forte. We don't have big pharma saying, "Hey, take this for that, and you'll be better." And or you take this cholesterol pill, yet you're 70 pounds overweight and you don't exercise, but you have low cholesterol. Well, I don't think anybody's going to argue with the fact that you should probably exercise and eat properly instead of taking cholesterol medications. If you need to take cholesterol medications on top of that, that's a different story. But if you just take cholesterol medication, that number goes down. That's good for you. But is it really good for you? Are you dieting? Are you exercising? Are you trying to live a stress-free life? Probably not. So again, that topic is another topic for another entirely different day. So what I hope you understand is the takeaway is neck pain can lead to loss of sleep. Chiropractors can help you by removing that pressure on those nerves. Now, it's not just the spinal nerves with like a pinched nerve. We're talking about the brain stem. It's neural tissue. The reticular activating system is a bunch of neurons or nerve cells that communicate directly to the hypothalamus, which is producing a number of different hormones, signals hormones. And again, that awake, sleep and awake cycle is really of what I want you to understand. So if you're having trouble sleeping, because if you don't sleep, you cannot heal. And listen, I understand if you're in pain, you want to pop an Advil, have at it. I'm okay with that. What I think you need to do is stop and think about it. Maybe call a chiropractor and find out. My name is Dr. Brian McKay, Core Health of Darien. I'm in the Post Road in Darien, Connecticut. And you're probably not on the Post Road in Darien, Connecticut. But if you have a question, and I do take questions all the time, 203 656 3636. 203 656 3636. Just give a call. My staff will give me the message, and I'm more than happy to get back to you. Listen, have a safe, happy, and healthy Labor Day weekend. Let's get that school year underway, and I hope you enjoyed this brief podcast. Thanks a lot. Thanks for listening. Tune in again.